we had a patient that came in and they needed a kidney transplant. And so they were in the hospital and they were joking with a friend and they said, I couldn't wait to have a beer when this is all over. And a nurse overheard this and wrote in the chart that this guy was an alcoholic and he got kicked off the organ transplant list.
Oh my gosh.
And so luckily they came to Solace, connected them with an advocate and went through this incredibly cumbersome process to change the chart and eventually got him back on the place on the list, ended up getting a kidney, ended up saving his life. And so while that's an extreme example, there are countless cases where bureaucracy, poor processes end up resulting in far worse healthcare outcomes for people than they would otherwise get, and healthcare advocates solve the problems that people face.
Welcome to Inspired. I'm Alexa Von Tobel. What if when you or a loved one gets a terrifying diagnosis, something serious and scary, you didn't have to figure out insurance, find the right doctors, and navigate our broken healthcare system all alone? Jeremy Gurewitz believes healthcare advocacy should be a right, not a luxury. He's the founder and CEO of Solace, which just raised $130 million Series C and is now valued at over $1 billion. Solace connects patients to healthcare advocates covered by insurance, helping tens of thousands navigate the scariest moment of their lives. Jeremy's mission is deeply personal. That is why he started Solace. Charlotte Ross on our Inspired team and I are proud to back Jeremy. We've been his teammate since their Series A, and we're always in awe of his relentless commitment to helping patients when it matters most. In this conversation, we're going to talk about how Jeremy built Solace from the ground up, why the U.S. healthcare system is broken, and what's coming next as AI transforms how we navigate care. As both an investor and a friend, I'm so excited to share Jeremy's personal story. Let's dive right in. If you're running a startup, we know things like managing equity and communicating with investors are always top of mind. Carta has built a connected suite of tools that over 40,000 companies use to do just that. Their platform of software and services helps you lay the groundwork so you can focus on building. To learn more or get started, visit carta.com. And with that, I'm so excited to welcome our friend Jeremy. First of all, Jeremy, Charlotte and I are so thrilled to have you here today. We are obviously very early investors in Solace and have been your teammate from the beginning. And I'm just so excited to talk about, the purpose of this podcast is to talk about inspired founders, quite literally people who wake up every day to make the world a far better place on behalf of tens of millions, if not billions of people. And you very much are one of those. Your mission is so profound, and that's what I think both of us, when we met you, it really clicked. So I want to start from the beginning, Jeremy. Just again, thanks so much for coming on today. Tell us a little bit about your childhood, and have you always been an entrepreneur? Let's start there.
Yeah, well, first of all, thanks for having me on here. Super excited to be here. And yeah, as you said, you guys have been with us since basically the very beginning. It's been wonderful to work with you. I'll give the plug right now for any founders who are considering working with folks. You need to at least have a conversation with Inspired. So we'll just kind of get that out of the way. But I'll repeat it again.
Disclaimer. We love you. We love you. We didn't pay you to say that. Thank you.
Well, it's true. So yeah, when I think about my childhood, I think a few things come to mind. First of all, and we'll talk about kind of my mom and my family story in a bit, but my parents always really encouraged me to just go for whatever I felt was like right and important. My mom had this saying of like, have a bad day or whatever, and she'd say, tomorrow, walk out with your right foot forward. And it was like this like thing of just like go out there and like, especially on my mom's side of the family, like comes from like a super accomplished family. Her dad, so my grandfather, was actually the first chiropractor in the state of New York. He had license number 1, and he like developed like the field of chiropractic as like as something that was super important. And just growing up, like my entire family just really encouraged me to go for things. And so, when I think about like childhood, it was just, whether it was, I wanted to spend a summer doing research somewhere, they just said, go forth, we'll figure out a way to make it happen. It was really just encouraging me to pursue something that I believed in, I think is what kind of has set me up for success here.
Well, first of all, I think in honor of your mom, that quote is officially now burned into my head. If you have a bad day, start tomorrow on the right foot. That's a beautiful quote. If we think a little bit about sort of a story or a moment in your life that you almost credit to be one of the ones that is kind of a pillar of how where you draw strength from as you try to do very hard things in your life, Solace being one of them. Um, is there like anything that you think of as like a direct line from your past to your future?
So I think I again go to my mom, and I guess we'll talk about again the story behind Solace, but my mom's passion for the work that she did was very significant, and I remember her saying, because we would get up in the morning, she would take us to school, and she was a doctor, and so she would have kind of a full day, and I remember she was kind of tired one morning and had an extra large cup of coffee and was kind of getting herself like ready for the morning and just kind of giving herself some motivational kind of talk. And I was asked her like, "Mom, like what's going on?" She's like, "There are people that are seeing me, and for them this is their life, and so it's regardless of what I have going on, they need to see me as the best possible version of myself because they're putting their lives in my hands." And so my mom was a radiologist. She was diagnosing breast cancer in women, and she felt that the patient doctor interaction was so critical. And so I've thought about that a lot. I've thought about that various times in my life as I've been working with people, and certainly with Solace when I'm speaking in front of people, and almost kind of regardless of what I have going on, it's being there for people is something that really kind of I remember very deeply.
And Jeremy, in addition to your kind of passion for like the humanity behind every patient that comes through Solace, I think one of the things that stood out to us when we first met was your quantitative background, right? Like
Yeah.
you went to Wharton, you worked in finance after college, um, and you know numbers really well. So could you talk a little bit about just like how that specific background has shaped what you do now and kind of how you build Solace?
Yeah, you studied economics at Wharton. Like again, you have a strong background in finance. Talk about that.
Yeah, so as you said, I went to Wharton undergrad. I started out my career in quantitative finance. I did that for a number of years before deciding that it was fun to make the number go up, but it wasn't like my passion in life. And so I worked for a variety of startups where it turned out that skill set was really effective in growth and in growing companies. And I think there are people that have very strong quantitative skill sets, but they're very stuck on just calculations and numbers. And I think for me, if I had to kind of give a reason for why I've been effective and I think successful in what I do, is numbers are representations of actual reality. And so when you're doing calculations or when you're making decisions based upon numbers and looking at the impact in the future, you really want to take the representations of the calculations and try and translate them into how reality is changing. And I think that, part of what you do as a founder is you are, it's like the famous quote, "You're making a dent in the universe," from Steve Jobs. You're kind of changing reality. And so the quantitative skill set is effective insofar as it helps me encapsulate the changes that I'm trying to make, whether it's on a company or whether it's on people, and then having that representation um, occur and be manifested in like the difference that's represented in the numbers.
I want to transition to Solace just because obviously there's so much to cover there. Um, obviously we met you as you were out raising your Series A for Solace. In plain English, what is Solace doing for the world? All of us are sitting here as human beings who care about our health. What is Solace?
Yeah, so Solace connects people to healthcare advocates. So we're a marketplace for healthcare advocates that's covered by insurance. Most people pay little to no cost at all. Right now, we're with Medicare, although potentially when we launch this podcast, or we'll be announcing soon that we're going to be launching commercial insurance as well. So if you have insurance through your work or even have purchased insurance in the marketplace, it's very likely that you'll be able to get Solace as well, which is something that's so incredibly exciting. the story behind Solace, and I'm sorry if I'm stealing your question that you were going to ask, but I think we've kind of alluded to it, is I've mentioned my mom. She unfortunately passed away from pancreatic cancer. And I got to see firsthand just how difficult it was for her to access care, even though she was a doctor, even though, my family's based out of New York and had access to like some of the best institutions out here. Like the experience was just really, really challenging. And I think after she passed away, I wanted to do something that would help people. And as I spoke to people, that what just came out over and over again was how difficult it was for people to get access to care. This is something that, even as I've spoken to people, and even when I was fundraising, and no investor ever denied that this was a huge problem. I think sometimes, I don't know what type of pitches you guys see. Oftentimes there's probably some things where you're like, is that even really a problem? This one was a huge problem. I think people always had the question of like, could this work? Could we get it covered by insurance? Could this actually make a difference? But it was very clear to me after speaking to healthcare advocates and discovering them and seeing the impact on their patients that this was something that could have a real impact. I would speak to a patient and they would say to me, I actually had a really good experience with the US healthcare system, which is something you would like never hear ever. Even with people that, have the means, have the connections, there were always friction points, but healthcare advocates made it better. And so what we do is we've built a giant platform, thousands and thousands of advocates, connect patients to advocates. And we've also built the tools and the software, and even dare I say, the AI technology to help advocates be super, super effective. And I'm sure we'll talk more about AI, but overall, we've just built this thing that just enables people to get the best possible healthcare and the best possible healthcare experience. And we've helped tens of thousands of people already, and we've been really lucky that a lot of people have found significant value in it.
Jeremy, I want to go back. When Charlotte and I met you years ago, before your Series A, you were clearly a guy on a mission. It was very that just meeting you, that was clear. Um, and I remember asking one question, and I'm going to see if you remember what you said. But I said to you, Jeremy, why are you going to be able to succeed? Like, why you against everybody else that could go try to build this? And do you remember what you said?
Yeah, I remember this one. It's because I care more than anybody else, very clearly.
And as you said it, it gave me chills. And you were like, I am going to be successful on this journey because I will literally care more than anybody else on the planet that can build this. And Charlotte and I both like left that meeting and we were like, that's the founder you want to back. That is an inspired founder to his core. And so I had to quickly say that as somebody who meets hundreds of entrepreneurs a month, that it couldn't have been truer, and it was exactly the right answer. And it's the most sincere answer. And years later, we still feel it.
I appreciate that so much, and thank you.
Yeah, and I would also say, like, I think for me, the thing that resonated most was like every single person that you share Solace with and like explain what Solace does, everyone has had that moment where they're like, oh God, I could have used Solace. And I think, actually right around the time we were investing in the company, one of my best friends was diagnosed with cancer. He is now fine, but it was the first time, he's very like well off, well resourced, has the right connections to the right doctors, and even still, it was extremely hard for him to kind of get the care he needed. And really opened my eyes to just like how big of a pain point this is that you're navigating. Like, could you kind of maybe walk through a few examples of how patients are using Solace?
Yeah, for sure. So we do a basic intake. So we actually have a team of physicians. So people, you meet with a physician, they confirm your diagnosis, they confirm your eligibility for advocacy in accordance with kind of like the rules and regulations for advocacy. And then once you connect with an advocate, that's your advocate. And so you work with the same person longitudinally. And that's one of the things that we've found is super, super valuable is you're building this relationship with someone. They know who you are. It's not like you're calling a random phone number and you're getting all these people. You have to explain what's going on. You have your advocate. So that's kind of like the first piece that I think is really worth calling out. Once you're with an advocate, you have an initial conversation, you explain what's happened, what you're going for. And then one of the most important things, and this is kind of like we talk about in Solace all the time, is we have a no homework ethos. So there, in healthcare, one of the things that makes it so painful for people is like, you go somewhere and they're like, here's this 27-step thing that we need you to do. And that's not how we operate. The advocate works on behalf of the patient. So, you meet with them, and then once you share the situation, then the advocate gets to work. And it can be, ranging from something super simple. Like oftentimes we hear I can't get access to a provider. I can't get access to the right doctor. Something simple, but like this happens all the time. And certainly even in New York, finding a primary care physician, incredibly difficult. And like, especially if you go down the list of specialists, or even if you're not sure the right way to go, that's like actually a very difficult thing. And that's like the most simplest thing. It then kind of progresses significantly. Sometimes we have people who are handling chronic illnesses and they haven't been able to find the right way to manage it, or they're having challenges on medication management side, or they need to understand the care plan. And then obviously in many scenarios, people are dealing with life or death situations. Perhaps you've just been diagnosed with cancer, perhaps there's an ongoing serious illness and you're being asked to make a very critical medical decision. And so while obviously the advocate isn't your doctor, the thing the advocate does is help you understand the situation, try and get you the best information possible, and help you lay out some of the different pathways that might occur if you're being asked to undergo different type of treatment protocols. We also have kind of all sorts of, sometimes I call advocacy deals with the sum of all edge cases. And like we have one, this is just one example that I've sometimes shared with people, where we had a patient that came in and they needed a kidney transplant. And so they were in the hospital and they were joking with a friend and said, they said, I couldn't wait to have a beer when this is all over. And a nurse overheard this and wrote in the chart that this guy was an alcoholic and he got kicked off the organ transplant list.
Oh my gosh.
And so imagine if you're in that situation, you're a regular person, you're very sick, clearly you need an organ transplant list. Like you get this notice, like how do you even deal with that? Very, very difficult. And so luckily they came to Solace, connected them with an advocate, and went through this incredibly cumbersome process to change the chart. They changed the chart in the hospital, and then it turned out, well, that's great. That still doesn't get you back on the list. So then they had to engage with the National Organ Transplant Registry. Took a month, got him back on the list, but it was actually, now they're on at the end of the list. So no, that doesn't work. He needs, the kidney is going to pass away. And so another month passed and eventually got him back on the place on the list, ended up getting a kidney, ended up saving his life. And so while that's an extreme example, there are countless cases where bureaucracy, poor processes end up resulting in far worse healthcare outcomes for people than they would otherwise get. And healthcare advocates solve the problems that people face.
Jeremy, said almost differently, you at Solace are helping people in the scariest days and hours of their life.
Yes.
I have chills even just thinking about it. It's the scariest minutes of people's life where the decisions that they are making really matter. And most people getting health diagnosis aren't doctors themselves, right? And why is the system so broken there? Can you and I really don't fully understand this answer. Why is it so hard to get the right care at such a critical time where it's literally life or death dependent?
Yeah, there's like a very, very long answer to this. I don't want to take up this entire conversation with that. So I'll try and boil it down. So I've spent a lot of time now studying the US healthcare system as part of the work here at Solace and trying to understand it. Without going into like the full history of US healthcare, if I had to like boil it down, what's occurred is there is oftentimes a bunch of well-meaning regulations and rules that end up resulting in very, very limited ways in which providers feel they're allowed to do things. There are also structures, and not meant to be political, but just like in terms of how the rules have been set up, where there are basically local monopolies everywhere. And you can look throughout the US healthcare system, there's consolidation, there's been limited things. And I think, what we see and historically is when you have monopolies, and you combine the monopolies with the very tight rules and regulations, it ends up being that there's no real incentives or ability for people to create a better outcome. And so you end up having all these cumbersome steps, you have all of these processes, and there's no real incentive to make things better. And so that's the challenge I think that's occurred. We could go into any particular detail about why a particular rule is the case. When you look at even just, for example, getting healthcare records, there's like a very, very long list, and truly the rules go into the thousands of pages about how health records are generated, the way in which they're allowed to be generated. So we've actually connected to, they're called like health information exchanges. We're connected to one of them that allows us to get health records. In normal databases, if you have someone's name or whatever, there's like an ID or there's a way to connect someone to their record. In the US healthcare system, you're actually not allowed to have that for various reasons. And so if you have someone's information, you have to search for them geographically. So like, which is like the most like in software, you would never say, okay, we're going to look for like this like soft database search geographically. So like, like that makes no sense, but that's just like one example, one niche example of searching for health records. And like the healthcare system is full of like rules that have good intentions, but have kind of combined over time, combined with the limited nature of competition and supply, that's resulted in like these really, really challenging kind of places.
And one of the things that we've loved about you from the beginning is you've come into this, you don't have a healthcare background. Obviously, you have your personal story, your brother's a doctor, you're a savant when it comes to like topics. But it's not like you kind of grew up in the healthcare system. You're coming at this from a real consumer angle. And I think with that have an ambition of like building a marketplace that's, like an Uber or an Airbnb, but in healthcare. Can you talk a little bit about just the advocate side of things? Obviously, before Solace, advocacy was like this niche thing, and now you're really creating a path for these people. Like, tell us about who they are and like how this population is growing, and where do you think it kind of will become, what it will become in like 10 years from now?
Yeah, for sure. So before Solace, there were folks that were calling themselves healthcare advocates, the most passionate, wonderful people. Got to meet a lot of them, and when we first started Solace, had conversations with many of them to convince them to give us a shot and work with us. People generally with healthcare backgrounds who've dedicated themselves towards solving this exact issue and are experts in this. As we've grown Solace, what we found is there's an incredible supply unlock where there are tons of nurses who really want to be healthcare advocates, and they are, in fact, in their day to day. I think so many people, if you've ever been in a hospital or a place, like incredible nurses do incredible work, and so we found that there's a lot of nurses who want to be healthcare advocates, and so we bring them on the platform. We have kind of a training program that kind of catches them up with kind of some of the things that they'll be working on. And we connect them with patients. And so I think it's just a fantastic opportunity for nurses who want flexible hours, who want to work for a super mission-oriented company, and to be able to work remotely is something that I think is just incredibly exciting for them.
Jeremy, if you think about how Solace is changing outcomes, how do you think about that? What are the metrics that you care about? And again, I think it's already an incredible lift to know that if God forbid you get any medical diagnosis that feels worrisome, where you're making a big decision, go to Solace and get an advocate who just works on your behalf to help you answer any question. But if you want to change the category, what do you measure? How do you think about that?
Yeah, so it's a very fair and great question. We've been asked it in a bunch of different ways. So we started this from a consumer perspective. And so the first place we have to go is like, are consumers actually, are patients finding value in the product? And we've been accused of this, like, how is this real? We have something like an NPS of like 90, which I think is like insane.
Wow.
And
Wow.
yeah, patients really, really find, and we ask just kind of the standard question, like, would you recommend this to others? Did you have a good experience? We ask them to rate Solace, we ask them to rate advocates, and just the responses are off the charts positive. So I think that's the first place we have to start. It's like, necessary. I wouldn't say like totally, like, and I'll go into some of the other things here, but you have to start there because I think oftentimes there are folks that try and approach solving healthcare without taking what the patient wants into consideration. So a great way to reduce healthcare costs is just not provide care to patients. And there are countless examples of this in the past where, and this is where some of the challenges arise where, if you have very intensive prior authorization protocols, if you have very intensive processes to even get access to physicians, you can lower healthcare costs by just not providing patients care. I don't think that's really what people want. So you have to start, the foundation is, are patients having a good experience, which I think we clearly have. The next step from my perspective is like, is there a way to measure improved outcomes, lower costs? And so we have some preliminary data right now, so we're still not fully, we haven't fully published all of it yet. where we look at longitudinal claims. So in other words, like you just look at healthcare claims data. There's like a standardized process where folks submit kind of codes representing the healthcare work that people do, and you can look at the costs for patients before working for Solace and then afterwards. And what we find is that when patients work with Solace, there's lower costs, which is really, really exciting. We don't have kind of like full numbers to announce yet, but it's something that when we publish it, I think is going to represent a pretty significant game changer for the industry. And we didn't even really talk about kind of the history behind kind of like coverage. In 2024, Medicare changed their regulations to cover healthcare advocacy there. And part of the thesis, and I've been lucky enough to engage with CMS and speak to the former head of Medicare who actually instituted these codes. And they had preliminary data and there's studies that show this actually. And I actually didn't even mention this when we're first starting Solace. I was looking up studies, and the study would go basically, we did some version of healthcare advocacy. We had a nurse engage with patients when they were transferred or discharged from the hospital and followed up and made sure they knew what to do and helped them with any questions and worked on their behalf. And the study would go, it made sure that patients weren't readmitted to the hospital, it massively improved outcomes and costs, and then we ran out of funding and then the program never continued again. And so when you speak to like when you speak to some of these folks at CMS, they have seen these studies. And so that was part of the idea behind them creating these codes is, can we create a way to actually, because they've known that this problem has permeated throughout healthcare. And so the work that we've been doing, I think, has been confirming that. And so then the last piece is like improving healthcare outcomes. And so there's a whole bunch of data, and it can be challenging because it's like, do you want to use mortality as an endpoint? You could. There's that can help for, I think, severe illnesses, but then there's also kind of other questions around quality of life, for example, and even just early, are you connecting folks to the healthcare system? So we're seeing increased engagement, which I think is something that's really, really powerful and is one of the key things that people look at. Are patients more engaged with the healthcare system? Are they engaging with primary care? There's been countless studies that show that when patients are engaged with primary care, that's preventative. It prevents kind of like the worst and escalatory diseases and kind of costs that tend to occur. And then right now we ask them this question. I think, again, we're still working. We've hired just recently a whole bunch of PhD researchers to go and attack the outcomes problem very directly. But we just ask patients, do you believe that you got a better outcome with Solace than you would have otherwise? And the answer is just undisputably yes. And so I think we have very, very clear data and information to show that Solace, it's kind of like this magical trifecta that doesn't really happen, where it's like good for patients, it's good for costs, and it's good for the US healthcare system. And I think it's something that's just super exciting.
Jeremy, I know you recently just raised a round, and you had a sort of a wild amount of interest in queuing money to Solace. And you've always been very, very thoughtful and measured about when to take capital and how to take capital because you care so much about your mission. Tell us a little bit about this latest round and this exciting new announcement.
Yeah, so we recently announced the round, raised 130 million, I get to say that fully, from led by IVP, participation from all our investors. I think we were really lucky that just even from our existing investor base, the round was deeply oversubscribed. We ended up actually raising more than we expected just from interest from existing investors. And obviously IVP, incredible investor, really excited to have them on board and lead this round. I think we had reached a point where we've made, I think, really substantial progress. The company is growing at an astronomical rate, and the additional capital will allow us to invest in the platform. So I'll give the plug now, hiring basically for every conceivable position, especially software engineering, product design. So if you have anyone listening to this that's interested, should definitely go to our careers page and check it out. So it'll allow us to invest in the platform and allow us to start investing in awareness. We've been super targeted with the way that we've done our go-to-market. We've tried very hard to lean into word of mouth, referrals, SEO, and some very limited targeted advertising because we've been solely focused on Medicare population. As we expand our go-to-market, as we release commercial, we want people to be aware that Solace exists. I think you mentioned this previously, where I mentioned Solace to people, and I hear the same thing, where it's, I wish I had known about Solace when blah 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 was what had happened to myself, to my friends, to my family. And so now with this round, the goal is to begin sharing that Solace exists to people more broadly. We're considering the best way to do that. And so when people have challenges, they know that Solace is the first place that they should go to connect with their healthcare advocate, and it's going to lead to better outcomes for themselves and for everybody involved. And so that's one of the main purposes in the round.
By the way, I'll give a plug right now. If you're out there and you want to work for a company where every day you can go to work and feel really, really extremely good about the work you're doing, go work for Solace, where every day you show up and you're helping somebody in their worst and scariest moment feel safer and more stable, which it's pretty good reason to go to work. So
Yeah, we feel inspired every day going to work.
As you think about growing the team, and I think you guys are around 300 now, you may get to 1,000 employees by the end of the year. You obviously operate with an extreme sense of urgency towards this mission. How do you think about building that into the culture as you guys scale?
It's really interesting. So we are a remote first company. So we do have an office in Redwood City, in the Bay Area, and so some people choose to work out of there, but the majority of the company is remote. And I think the way that we've been able to scale so effectively, even with all the people that we've hired as a remote company, it's very hard and has its challenges. The way we've been able to do it, though, is to operate with a really high trust culture. The way that we operate with a high trust culture, and I get asked this sometimes, and I always tell people it's kind of the same thing, which is people know that when you lay out a plan, you execute on that plan. And that's something culturally that's really, really important, that people know your word is your bond. And so that allows people to move really quickly. I think, I know I've worked, and hopefully you guys haven't had, but if you work for a company that's low trust, there's all this bureaucratic nonsense. Is like, per my last email, you have indicated that you're doing this, and therefore my expectation is you're gonna, like, all of this overhead nonsense doesn't exist at Solace because we operate with super high trust. We strongly believe in documentation. So we write everything down. We have the saying internally, if it's not written down, it doesn't exist. And so that allows us to move super fast. And so I think those are kind of some of the key tenets for us, where we operate super quickly, we operate super high trust, and then we really, really try hard to hire people who are committed to the mission. I think there's a lot of places for people to work, and obviously we're doing well, but if you're here just because we're doing well, this isn't going to be the right place for you. We want people who really, really care about what we're doing. And I think if you have that, that's what enables, I think, such a strong culture, where that people operate with integrity, people operate high trust, and people are here for the right reason. And I think that results in us being like a really fantastic place to work, and we get a lot done.
I want to talk a little bit about where healthcare is going, and as really a pioneer in a new category. And as Charlotte said, it's really the Uber Lyft, but for critical health support. And you've created a marketplace where people can come and get support. Let's just quickly step back. So the U.S. today spends over $5 trillion a year on healthcare, nearly 18% of GDP. Yet patients are still relying on phone calls, paperwork, and waiting, just sitting there waiting when something goes wrong. And being a human being on this planet who's had lots of people in my life have major health issues, it's really scary. And that waiting is scary. Um, when you specifically look at healthcare navigation and advocacy, how do you think this layer could change over the next decade? And kind of dream with us. What do you want to build in this space?
Everybody in the United States will have a healthcare advocate as part of their care journey. It's very clear to me now that this is going to be the case. It's going to be covered by insurance. It's going to be a natural part of treatment, to the point where, like, if somebody doesn't have a healthcare advocate, you're going to be like, oh, how come you didn't connect with your healthcare advocate? So that's very clearly the case. That's Solace's mission. Everybody can, should, and will have a healthcare advocate as part of their care journey. We talk about kind of our core values here of empowering patients, improving outcomes, and restoring the promise of the U.S. healthcare system. And so all that is super tightly linked. And so, I could talk a lot about all of that entails. So I mentioned before that we've built a huge amount of tools for healthcare advocates. There's going to be so much in the future. And so I think you gave the current state of healthcare, which is really challenging in so many different ways, but I'm actually a huge optimist in terms of the future.
I like to hear it. Keep going.
Yeah. Well, I mean, I think the thing is there's tons of companies that are working to solve these very nitty gritty, the term is interconnectivity or interoperability problems within healthcare. And so in the future, and we think it'll be through Solace, all of your health records, all of your information will be in one simple place. There will be tools to kind of demonstrate kind of what's happened, what you need, and given the latest information, what you should be doing. And all of that will be encompassed by your healthcare advocate who you have a strong relationship with and who's going to be able to help guide you on every step along the way. So that's very clearly where healthcare is going to go. And I think when you think about that in the future, there's all sorts of really positive things that come from that. Because when people aren't constrained, like right now, people are so tightly constrained in terms of like, everything is super tight. There's no availability for anything. You're so desperate to see somebody, you're willing to take pretty much anything. In the future, when everything is beautifully oriented, everything's really nicely done, using AI tools. Like, we're not like an AI doomer by any stretch of the imagination. We believe AI can be a tool for good. It's not going to be the only thing. You know, there's some people that like want to believe that it's going to be like Blade Runner, where there's AI, like, you know, AI is going to run everything, which, like, you know, who knows? Like, I personally don't think that's going to be the case. I think AI is going to be a tool that's going to be used super effectively for people, but it's not going to be the only thing, right? And so having the advocate that has all of that at their fingertips, that's like the connective tissue across the US healthcare system, where you as a person, when you're going through your own healthcare experience, everything is beautifully oriented. Like, if you think about the top tier consumer experiences, pick your consumer app of choice or your consumer experience where you're like, this is an excellent experience. You could think about, you know, luxury brands or high-end hotels. That's the way healthcare is going to be in the future. And like, our mission at Solace is to make that a reality.
And I think, you know, I mean, you touched upon AI a bit, and I think your superpower, you know, at Solace is like the product and like just how robust and expansive the product is. And obviously, like, we believe alongside you that like there's a real element of humanity that needs to exist in the process. But like, talk a little bit about how you are infusing AI into the patient experience, like via your product roadmap.
And I want to piggyback on that and just add, so there may not be a better example of a critical, extremely scary life moment of a decision where people want a human, right? Like, I think Solace may be like the perfect example of when a person wants a human. How do you think about when you get a human and when AI supports it? And how do you think about that as you guys develop the product?
Yeah, so it's very clear to me that when people have very, very narrowly tailored questions, you want to Google, I don't know, how many red blood cells are in a drop of blood or something. Like, yeah, obviously, like, AI is like how you go to that. But when you have a broad problem that you need a solution for, you want a human, and especially when it's broad and uncertain and honestly really scary. Huge amount of not only just desire but also value is it having a human being organizing the entire thing. And so when we think about kind of healthcare advocacy in the future and what Solace does, person to person relationship, person to person contact, especially, you know, when you're dealing with a Medicare population or even somebody who's really sick. I have to say, like, you know, my mom's experience, she was someone who knew everything about, you know, felt like to me, knew everything about healthcare and, was a physician and honestly served as an advocate basically for many of her family members. When she got sick, she wasn't the same person anymore. She didn't have the capacity to do that. And that's something that I think so many people forget, is that when you're going through that, you need somebody to be able to take care of you and handle kind of these types of things. So to us, the person to person relationship is incredibly powerful. And like, I don't see any kind of risk there. Now, Charlotte, to answer your question about kind of like, well, how do we use AI? We think that AI can be useful in so many different ways. So we have AI co-pilots for our advocates. So if advocates have particular questions about very narrowly tailored things, they can ask the AI. We have our own proprietary data set. So basically, we have a huge clinical team. We have, I mentioned, researchers and doctors and people who know so many things about healthcare. And we've created our own data set that the AI can refer to. So that includes clinical information, very carefully sourced and vetted research, as well as the information that we have about how advocates are helping patients in reality. And so that's one of the things that I think people don't appreciate, you guys appreciated it when you invested, but just the opportunity about having that compounding data moat is something that I think is really, really powerful, because we take everything goes through the platform. we're able to work with the advocates and see how they're able to help problems, and we gather that information and have it in our system for the future so that it helps the network more broadly.
The example that I remember your co-founder Sarah shared with us was I think one patient had wanted a seeing eye dog
Yeah.
for their
Yeah.
patient, and obviously like that's a unique request, right? But you guys built into the product a whole pathway for when the next time that comes around, it's like an instantaneous deliverable.
Exactly. Exactly.
Um, Jeremy, just given that you have an interesting perch, what are your predictions for healthcare as you think about just it's 2026, this wild wave of AI. Everyone thinks AI is going to do everything. What do you see as just like your predictions of where the world could be? And this is not just Solace. This is just the whole category in a decade. Uh, what's obvious to you that maybe isn't obvious to everyone that's listening about AI in healthcare?
I'll make a few fun predictions, and some
Yeah,
of
we
them will
love
be a little.
we want some predictions.
Well, some of them will be out there. So some of them will be a little nitty gritty, and then some of them will be maybe more broad, fun ones. So nitty gritty, the restriction on physician-owned hospitals will go away. So right now, there's a regulation that says that physicians are not allowed to own hospitals. And again, like most healthcare regulation, the spirit of it was that people were concerned that physicians would direct folks to their own hospitals, and we don't want that. But the reality is that now it just has meant that hospitals are kind of they're owned by for-profit companies, and again, some were for-profit companies. Some of them can be good, but some of them don't really do a good job, or these kind of giant nonprofits, which again operate as local monopolies. And so, to me, it's very clear that, and I think you see this in so many categories across the board, is when you have competition and when you have choice for people, that ends up resulting in generally better outcomes because people have to push for it. So the restriction for physician-owned hospitals will go away. There's been a lot of really interesting models, different care delivery models in terms of like, because right now you imagine a hospital and it's this like giant building with like 1,000 different things in it, but it doesn't need to be that way. There can actually be micro hospitals or kind of like very small tailored particular things to a specific like treatment. Like there's no reason why it all has to be in this giant super complex operational thing. And so I think in the future there's going to be way more choices and way more opportunities for people to experiment with different ways to help people in their most critical pieces of need. So that's one kind of piece. I think one of the other things in the future is, like, as I mentioned, it's very, very clear to me that all of the data problems will eventually go away. So like that's one of the biggest things: getting health records, connectivity, um, treatments, matching all that. Right now, the systems are so bad. It's like you have all that, and it's very clear that in the future, by default, and Charlotte, you and I were talking about this briefly, every single interaction you have with any practitioner across the healthcare system will be recorded, uploaded somewhere, captured, and going to be matched across your own medical record. And so, in the future, all of that data will be existing, captured by AI. Captures the wrong word. Analyzed by AI and used to kind of predict what's going to matter the most for you in the future. And I think the last thing, and this is something that I think there's a lot of companies that are really working on this, and we'll see, is I do really think personalized medicine will become a real thing. So I think there's been a lot of attempts on it, and it's still like very far away in the future. But if you read a lot of the clinical research, they're getting closer and closer to understanding like the chemical interactions again with the power of AI. And so I do really think that in the future there are going to be treatments that are tailored to you very specifically. The more research we have, like the more we see that people's biomes are totally different. Not even like your genetic code, but even just like the way your cells are oriented, the way your gut operates. And so in the future, there's going to be very tailored treatments to you specifically. That's going to help in a very broad variety of ways. So hopefully that's interesting enough.
Jeremy, I want to move a little bit to you as a leader. And I think you and I kind of share a philosophy with Charlotte that urgency really matters. I think I always say CEOs are engines, and they kind of set the speed of which everybody moving. But you uniquely have always operated with an incredible sense of urgency, just given how important the task at hand is that you're managing. How do you build two things: that core sense of speed and urgency into the company in a safe way, just given that you're not just selling widgets, right? Like these are really important things that matter. So how do you develop that sense of urgency? And then I have a follow-up question.
Yeah, so it's a really fine balance because obviously, and I think you see this with a lot of founder CEOs of like, you could always by default just say, nothing's ever good enough. We have to move faster, blah, blah, blah. And I think that's actually a mistake to just have that be the blanket default. Instead of instead of just saying nothing's ever good enough, what we say is like, um, we use like the maximum possible amount of urgency when it comes to a particular thing. And so we are very strongly committed to setting goals and deadlines. And we push hard to understand what causes time delays. So, like if we're building a piece of software, we do, not only do we have a PRD, but we ask our engineers to, write down, for example, what are the riskiest parts of a thing, what are the areas that we think we can push on. And I think it makes sense to like you want to treat people, like adults. Like what I think myself and my co-founder Sarah, we drill really, really deep into the details. So, for example, even if it's a marketing project, we say we think it'll take a week. Why is it going to take a week? Let's understand the specific uses of time, and let's really drill in on if we think that those um, marginal increments of time are going to add the additional ROI or the value associated with that. And so I think that obviously you can just have that blunt instrument of just say move faster, nothing's good enough, but we try and instill in the culture, and because sometimes there are things that do take time, like if you're building a really critical feature or something that the patient is directly seeing, the last thing you want in the world is to ship something buggy or ship something that breaks or would be unreliable. And so those are types of things that are really good uses of time, and you have to build in uncertainty when it comes to software, and you have to build in testing time. I think that it sounds a little bit like simplistic to say it, but like being sophisticated with time allocation and being thoughtful about what's worth spending time on and what's not, I think is the way that you can instill a sense that time is incredibly valuable and you want to use it to its utmost.
I want to shift the sort of quick fire round where we just asked about some of the things that have helped
Love
make
it.
you you.
Okay.
And so I'm just gonna ask some questions. I want like first thing that comes to your mind. The first is, what book have you read in your whole life? And it doesn't have to be a business book that has left a material sort of impact on you and the way you think.
Oh man.
Jeremy's an avid reader too. I feel like you read like a book a week or something crazy.
Yeah, I read a lot of books, and so like 5 books popped into my head.
I'll let you pick two. How about that?
The Great Divide by C.S. Lewis is what popped into my head, which is a pretty intense one about the nature of the choices that we make in our lives, is maybe
Wow.
one way that I would say that. And then I'll just say Beyond Good and Evil by Nietzsche, which is philosophically how we think about what matters.
I love it. What's a mantra that kind of runs in the back of your head? And it can be anything, but it's just sort of a mantra that you kind of come back to or believe in.
Nothing is impossible.
I love that, Jeremy. That is very you, by the way. Um, what is a habit that you've adopted? You're now at the helm of probably one of the fastest growing companies in healthcare, period, of the last 20 plus years, which that alone is a crazy achievement. And I know in your mind, we're in chapter one, just getting started. But what is a habit that you've adopted so that you could be a sturdy pilot?
I've become really obsessed and maniacal about making sure that I exercise, which sounds funny, but I've found just whenever I skip it, the impact on my mood and even just broadly speaking, I'm not as effective as a CEO. So exercising is everything.
Amen to that, by the way. Um, when you think of to date, a pinch me moment at Solace, something that just like you really went home and looked at your wife and were like, I can't believe that. Like, what was that? And I'm sure it's not the fundraising. What was a pinch me moment for you?
So we recently held our company offsite in Miami, and we had over 200 Solace. I forget what we're called, Solations. 200 Solations there, and I was speaking in front of them, and I remember calling my wife that evening and just being really moved by, because people have lives and they could choose anywhere they wanted to work. And I just feel so grateful for the people that have chosen to work with us. And I think they're exceptionally talented people. And to just see everyone there, and, just thinking 4 years ago, it was just myself and Sarah, is just really, really moving.
I'm going to end on one fun one, which is in 10 years, Jeremy, what does this look like?
Yeah, we're going to be a publicly traded company. As I mentioned, everybody's going to have a healthcare advocate. We're going to be helping millions and millions of people, and we are going to be a fundamental piece of U.S. healthcare, and we're going to change the way healthcare is done in the United States.
Amen. Jeremy, just again, speaking on behalf of both Charlotte and I, we're so grateful to be your teammates, and thank you so much for just letting us dream a little bit about the future of our healthcare system. Jeremy, if people are out there and have a loved one in their lives that needs care, where do they go?
Yeah, just go to solace.health. Can easily find us, or just Google Solace Health, and we'll pop up, and we should be able to help you.
Yes. So spread the word. If someone in your life needs to make a big, important healthcare decision, solace.health. Jeremy, we're rooting for you. Thank you. And I can't wait to see what you do next.
Thanks so much.
Thank you all so much for tuning in today. If you enjoyed the episode, please rate, review, subscribe. We'll be back again with another episode of Inspired with Alexa Von Tobel. Thank you.